here. Welcome everyone to the Prosper Nutrition Show, where we want you to prosper and be in health. My name is Jason Steves. Today, I am joined by our regular co-host, Steve Steves, who's a certified clinical nutritionist and naturopath. And we also have a guest today, Dr. David Francis, who is a dentist here in the North Houston area, not just a regular dentist, but I guess you could say a holistic dentist. Mm-hmm. And we're excited to have a conversation with him today about dental health and how nutrition plays a part in other lifestyle factors. So welcome everyone. Thanks for joining us today. And we've got some audience members as well that are joining us too. So you may hear them as well. But today, like I said, we're going to be talking about dental health, how nutrition impacts dental health. We'll be getting some strategies from Dr. Francis on how we can improve our dental health and different strategies that maybe, are simple to implement, but maybe not known by most people. So we get definitely excited about that. So Steve, you have been a blessing to our lives. I don't know how many of you have heard about his testimony, but I'm going to turn the volume down here. He is the reason why all of us are here. He went through a severe form of rheumatoid arthritis that he was diagnosed with in his early 20s. They said he'd be in a wheelchair around 40 or 50, but he is now 65 and running all over the place. And now he's helping others to improve their health, overcome severe diseases, life-threatening diseases that and we want that for you as well. If you're watching and listening to this live, or if you're listening to the recording, we're here in the Houston area, but we're also online at prospernutrition.com. And so stay connected with us. And we're a family owned and run business. So we want to do things well. We want to get results. We want to grow the business, but we're not just about making money. We want to help people get results. And so that we're excited about that. So we have some questions, but first, Dr. Francis, if you don't mind, tell us a little bit about yourself, how you kind of got into this. That would be great.
So I'll try to keep it brief because I can be wordy. So my undergraduate degree is in nutrition, and my intention was to go to medical school. And just the closer I got to actually applying for medical school, I just had an uneasy feeling about it, and I was trying to shake it, and I was working through it, and just never got rid of that uneasy feeling. That's the best way I can describe it. And went through that whole thought, emotional, spiritual process a couple times, and just couldn't feel good about moving forward. So after I graduated from undergrad with my degree in nutrition, doesn't qualify you to do a whole lot professionally as a sole credential. And so I spent a few years trying to figure out what I was going to do. I worked with a kind of functional, holistic medical family practice physician, and he was incorporating diet, lifestyle, Weston Price style nutrition, standard process supplementation into his practice. And so I got to work with him for a few years, just trying to figure out what I was going to do. And met a couple of young dentists, and started talking to them about their career and their life, and they were far more positive than the doctors I was talking to. And then I feel like it was literally, this is going to sound maybe cheesy, but kind of a calling from God. I was taking my last couple prereqs at the community college in Corpus Christi, which is a fun story, but just because I wanted to get back into school and I needed a couple prereqs. And I was studying one night, and I'm going to be specific with the story real quick. I was sitting on my bed in my bedroom. I was married, had a couple kids at the time. And my back was to the wall, sitting on my bed, reading my physiology book that I was studying. And I literally heard a voice that said, "Have you ever considered dentistry?" And I said, "No." I had to turn around. There's nobody there at the wall. And everything fell into place from there. It wasn't an easy road. It was so long. It took 2 years from that thought to finish my prereqs, to take the admissions test, to go through the application process, and finally start dental school. But I can testify that God is good. He opened the doors it took a lot of courage for me to walk through them. But when I started dental schools here in Houston, I knew that I was going to find kind of the holistic element of dentistry, the way I'd seen it practiced in medicine at the medical practice I was a part of for a few years, and didn't know what it was at the time. I just figured there was part of dentistry that had incorporated that. And so I'll sit in class, Googling, because we all had our laptops open all the time. What is holistic dentistry? And I found a few dentists in Houston. I learned it was called biological dentistry, is what the core. Anyway, and so I started learning about it during dental school, and formed a relationship with Dr. Glarus, the biological dentist whose practice I ended up working for and buying. Kind of nurtured that relationship throughout school, and everyone just kind of
That's cool.
fallen into place.
So how long ago was it that you took over from Dr. Claros?
Bought the practice in 2018,
Okay.
so six years now.
Okay.
Yeah.
Nice. Yeah, he had a pretty good client base, I imagine, following people getting great help from him.
Yeah, he served a lot of people very, very well. Changed a lot of lives. Getting people's mouths cleaned up.
So your dental office, how can people find it? How can people
So website is beyondbiodent.com, and that's the best way to find it.
Beyond Bio?
Yeah.
Okay.
Yeah, I'd like to give a little plug on it because I've been going to see Dr. Francis for some time now. And I used to tell people, nobody likes to go to the dentist. Avoid the dentist at all costs. Right?
I do.
Not anymore. I mean, I wish I could, I'm going twice a month now. And everybody's like, why are you going twice a month? Well, I'm not going to tell you. Because you need to find out the excitement behind going to a dentist to really improve your health. He's got some unique tools that he does. We don't have time to go into them all.
Right.
He's got a depth of wisdom that goes beyond normal dentistry. And I'm really excited. That's why we invited him on the program. So I just wanted to share.
Of course. Yeah. We'll take that on.
Okay.
So what we'll dive into now is maybe you can introduce us to why nutrition is important for dental health, and then Dr. Francis, you can kind of touch on that as well, and then we'll get into this kind of the first stage when you're talking to somebody that has dental health issues that you notice, Steve, when they come in the office. Where do you start when you're starting to talk with them?
Well, part of me is hesitant to even respond to that because knowing what he had studied in that undergraduate degree, and I heard him talking earlier to people here in the office, I'm like, I want that guy to be here in this office working with us, directly. It'd be great. But I love their clinic. It's just the ambiance in there, the feng shui. You go in there, it's like, I want to be here. And the people that work there anyway. But on the issue of nutrition, teeth are alive, aren't they? When I first saw a picture of what a tooth looks like with the tubules that literally are like these tubes of access of how nutrients can go literally through the tooth. It's like, wow, they're porous. We got to be careful what we put in those pores, like our skin, right? What do we put on our skin? So we had that real conviction early on. And so we've always been looking for natural focused dentists throughout the Houston area for many years, from there with Dr. Claros before you were there. But so nice to have you and your young passion. I say young, you're the same age as Jason. And you've got the experience now too, that I'm so confident to send people over to you. But I'd like for you to share more about that nutritional aspect, because you were talking about pH with some folks. So we have our own little pH poster. I know you noticed that up there on the wall. And that the relationship of acidic foods and how acid affects the teeth. And of course, I always see like the O blood type individual that has a very acid stomach. They are always, if you look in their mouth, or there are so many more cavities in their mouth than the other blood types, because that blood type generates so much acid, and they're heavy meat eaters, and consequently their diet then becomes real acidic. And that acid food causes mineral depletions, and they don't tend to eat as many mineral rich foods, which would be, fruits and vegetables. And so that mineral depletion, then that's what the structure of the tooth is made up of. You've got a lot of mineral density that's involved. Of course, calcium, the vitamin D factor is a big one too, which we won't have time to talk a lot about vitamin D, but it's certainly an important one. It's so misunderstood. Doctors are poo-pooing too much vitamin D. We just watch the calcium levels in the blood, because that's what vitamin D does. It'll drive that calcium up in the bloodstream from the gut, and it's part of that passageway. But then we need vitamin K2 to help carry that calcium into the teeth or into the nails, into the bone. And K2 is used in the body to make a matrix protein, which carries that calcium where it needs to go. And we need a lot of calcium, but we need it in the right place. And it oftentimes gets misdistributed with that acidic diet, and the body's looking for it, and it's going to draw calcium out of the bones, and it's going to draw calcium out of the teeth. My wife got 7 cavities when she was pregnant with Jason, because we weren't eating healthy. She was eating too acidic, and I think Dr. Blair is filled up back in the day. So we know what it's like to go through that and suffer not taking care of our diet and our teeth suffering and nutrition wise. But tell us more about, you kind of, it's probably a struggle having somebody in the chair, because you got to take care of their teeth, but then again, their whole lifestyle needs to be modified to where you can really see an impact in their health. How do you do that?
Yeah, so that's it. I'm going to do a quick origin of what is called biological dentistry, and then talk about the direction I see dentistry, or kind of health-oriented dentistry, going from here. Because I think the whole the biological dentistry community is at a crossroads right now. The origin was, how is toxic dentistry affecting the rest of the body? And so they're looking at mercury amalgam fillings, looking at root canals, looking at other metals in the mouth, saying, what are dentists doing that are harming people's overall health? And so biological dentistry was formed to eliminate those materials from being continue to be used, and then also to safely remove them from the mouth. So that was the whole foundation that Dr. Glaris and his generation of biological dentists were all functioning on, was let's take toxins out of the mouth that dentists are putting in. Fluoride, mercury, root canals, which is really just chronic infection in the mouth. How can we pull that out safely and put something, I'm not going to say non-toxic, I'm going to say less toxic, back in, and you still have a functioning set of teeth. So that's biological dentistry.
A little side note to that, most of the dentists doing that don't know, right, that it's toxic. And so we've got this situation that occurs from way back, and we're talking about the American Dental Association formation and so forth, and these groups that started in the 1800s that impacted what we see today. And so this old school thinking is hard to change. And Jason, I don't know if you've got the video snippet of the smoking tooth. Can you show that to the audience so they can see a 25-year-old tooth that was extracted from the mouth that had an amalgam filling in it, and they put it in front of a phosphorescent screen, and they rub it a little bit like you're chewing action, and they can look at the methylated vapors of mercury that come off of the tooth, which that's what's in an amalgam. The toxicity of the mercury is, it's 48%. Is that right, Rachel? I think
Approximately 50.
Yeah, 50% of the filling is made up of mercury. We know those preservatives, well, it's the only thing that they can link. And you can go to brain neuron degeneration on YouTube. University of Calgary in Canada actually did that research, and they show the neuron, the only damage to neurons that create these fibrillary tangles that are seen in Alzheimer's disease brains come from this methylated mercury. Now, and of course, in their research, they comment that the greatest source that humans are exposed to that is from amalgam film. So anyway, go on with your talk. I wanted to put that plug in there about toxicity, because a lot of dentists do it unknowingly. And when you know, then it's, wow, It's a hard life to live this type of dentistry because you come under a lot of persecution from the norms of society of what everybody else is doing.
Right, Dr. Glarison, and I want to say his generation, they took a lot of arrows so that people like me can come into a much more friendly environment. Yeah, my dental colleagues still kind of look at me and kind of don't understand what I'm doing or why I'm doing it, but they're not coming after me the way Dr. Glarison and his colleagues were aggressively being pursued for being different. And so you said, dentists don't know, they know. They won't admit.
They know now.
Dentistry still won't admit that the toxicity of the mercury and the different materials that are being used.
It's so hard to identify because when you're looking at a molecule that's so small on that smoking tooth video, the nanoparticles, we're talking about a particle that is like 1/1 billionth or 1/1 trillionth. I forget if it's a nano or a picomolecule. It's so small that they have troubles identifying the impact of it. It's hard to see and follow that in body chemistry. Of course, we do hair analysis, which is the best way to decipher if a person is in fact contaminated with a heavy metal. It's easy to do, and you don't have to do the provocation and collect the urine. And the urine, it's sometimes when you use a chelating element to measure urine excretion of heavy metals, you run into trauma to the kidneys, trauma to the organs of elimination because you put in this strong chemical to remove it. And in fact, there's a lot of dentists that do a lot of amalgam removals. If they don't do some of the safeguards like you're doing with the ionization on the wall and so forth, that mercury molecule affects you as a dentist.
Right, and that was one of the big things is that the safety protocols include protecting the patient from exposure, but also the dentist and the staff, because we could do 2 or 3 or 4 cases in a day sometimes. That's a lot of exposure to vapor if we're not controlling that. And so yeah, I say we're all hazmated up, masks and special filter masks and face shields and covered head to toe and special air purifiers and ionizing filters and all those things because mercury toxicity is a very real thing. Dentistry is the most toxic profession. Like that you see the reports about the most dangerous or most toxic profession. Dentistry is at the top.
I would agree.
Sorry, but people's mouths are disgusting.
Yeah, and I know some dentists in that field who weren't protective enough with what they were doing like you are, and they ended up with kidney cancer and losing a kidney and so forth.
Right. So, you mentioned that, when your wife was carrying Jason just a few years ago, and she had, this onset of cavities. The problem is that the answer to that still to this day is fluoride and brush and floss your teeth. That's it. And so when I'm saying we're in a transition point, my understanding, my observation is that less toxic dentistry is being done. So amalgams for the most part have been phased out of usage in active dentistry. And so the generation of people, using that word today, who have a lot of amalgams is starting to fade. Just because either their dentist has already replaced it with the new pretty white color fillings, or they're waiting to come to see somebody like me, and no new amalgams are being replaced. Root canals are still a very, very strong industry. But those are also starting to fade a little bit because of the rise of dental implants. And so, which have their pros and cons compared to something like root canal treated tooth.
Or a bridge.
And but my thing that I'm getting most passionate about is what you talked about, is the true systemic health impact and how it correlates to good oral health. So we're looking at toxic dentistry and then good oral health. That's strong teeth, strong gums, healthy bite, healthy airways so you can breathe. Sleep apnea is a big thing right now in dentistry. And so that's a whole new field, and this kind of a partnership relationship kind of deal is what I see tying that together. Right. I'm excited about that because there's so much to learn that goes beyond brushing and flossing your teeth for good oral health.
Now, you also work with some healthcare practitioners that do sleep evaluation, and you can send a patient home with a device that's not a difficult sleep evaluation. They can keep it on their body, send it into that clinic, and they can tell the patient whether or not they're dealing with the sleep apnea, which makes sense when your teeth are off-gassing poisons and that's getting into the sinus cavity. Obviously, the sinuses then swell, you don't breathe well, and obvious, so.
Yeah, this is, I mean, I think that this is gonna help us transition because these issues are kind of what we've been dialing into in regard to the health field, like the medical health community, what's going on there and how certain people's chronic diseases aren't necessarily resolving. And when we get people here in the clinic, we're trying to help educate them on how you're supposed to take care of the body so that those diseases can resolve. And this, one of the disease, or one of, a lot of the diseases are in the mouth as well. So, but kind of adjusting a little bit in our focus here, wanted to kind of touch on some of these questions that people have asked, while not moving away from, you know, educating them on the new approaches. I think that we'll be able to touch on these new approaches with some of these questions because it'll help kind of you be able to frame things for us a little bit. So we had one person write in that she or he had dealt with gingivitis for a long time. They said they're tired as it is a constant upkeep, and they've been wondering if there's a supplement or something they can do to add to my nutrition to help with this issue. So this may be a Steve and your question. So would you want to start that off, Steve, and then maybe
No, let him get it.
Okay.
Rolling, yeah.
let him get it rolling? All right, go ahead, Doc.
Well, I wish I could say there was, you know, a tried and true supplement or practice or protocol that would fix gingivitis. That would be amazing if there was. It's not typically that simple. The most simple starting point is good brushing and flossing. If that's not happening, if you're not cleaning out, bacteria build up around your teeth, then you could have gingivitis. But the real question is, why do you have gingivitis? So it could be plaque buildup. It could be nutrient deficiencies. It could be genetics. You have a overreactive immune system, and so that's causing inflammation in the gums. It could be a hormone imbalance, which all these things are his topics, not my dentist. You know, you brush and floss, use your fluoride, and swish with Listerine. That stuff doesn't work. It doesn't help. And when it's not, the people who have gingivitis because they have plaque buildup, brushing and flossing works. For the people, most other people who have gingivitis, despite the fact that their teeth and their gums are super clean, it's a systemic issue. It's a different kind of a problem. And that's where I think good diagnostics comes into play. And so learning how to get to the why is it happening, that's where people like you guys come in. Because dentists, we're too dumb to understand that, one, the mouth is connected to the body, and how to make that connection through good data.
Now, when you use the word systemic for the first time, I was like, this guy's in our court. Yeah, this was, so many things knit our hearts together so fast. I was just so excited to see. And it took my son-in-law to tell me about it. I hadn't drawn the two connections together, but when anything that has an itis on the end of it, like ankylosing spondylitis, that I was diagnosed with rheumatoid arthritis one. Autoimmunity, he did make a comment of that. Autoimmunity goes back to triggers that upset, it's protein mimicry is one of the things that causes it. The different proteins in foods will set off the immune system. For example, dairy has a trigger that is linked to type 1 diabetes, autoimmunity, because the protein in dairy is very similar in the amino acid structure to the proteins in the pancreas. And so the beta cells of the pancreas, that similarity, the immune system sees the dairy, develops antibodies, starts to go after the dairy, but it also looks at the pancreas and goes, oh, we have a protein structure over here that's very similar. So your own immune system starts attacking its own cells of the body. It attacks the joints in rheumatoid arthritis, which I had. So until I did a lymphocyte response assay, food and chemical sensitivity test that we offer here at the Nutrition Center and Health Center, to identify those triggers, you know, I've learned through the years, my triggers keep changing. My environmental sensitivity keeps changing of things that I was consuming all the time. So if I want to enjoy my latter years and have less inflammation, You know, I'm even talking to Jason about possibly getting back out on the ultimate frisbee field, but he's my trainer, and so he's gotta keep my knees rehabbed and everything. So I can push my body to enjoy running with my grandson is the main reason I'm thinking about it. He sent me some tempting pictures yesterday. They were doing that. Well, anyway, the itises, like gingivitis or any inflammatory condition, has got an autoimmune trigger, and it's usually food related. It's always a trigger by food. The environment is a big factor. You got funguses, you got molds, you've got toxins. The toxicity issue is that trigger along with that, but food just adds to it. And our food and chemical sensitivity test is more than just testing food. It's gonna measure, you tell them, Jason,
Yeah.
you've got the niche on.
Yeah, it's food, the LRA is the lymphocyte response assay, what Dr. Francis was talking about. Look, genetics, epigenetics is a good word to use. It's essentially the potentiality of disease based on how we influence our genetics by our choices. So that's something that we can identify certain things in our environment with a immune test called the lymphocyte response assay, looking at certain aspects of the immune system and what in our environment for food and other chemicals in our environment our body is reactive to. And this is these change, right? This is the adaptive immune system, so our body adapts, so it changes over a 3 to 6 month period. But it's helpful to know this because it'll help relieve burdens on your immune system, and your immune system is able to focus its attention then on repair. Because that's something that is often forgotten about the immune system. A lot of people think, oh, defend, but the immune system is responsible for repairing the body as well. And so that's something that's really missed, and identifying these things can help the body focus that attention more on repair when you're not having so much burden. So,
Jason, those are the two main things, but I think about that third one, we don't want to forget: defense, repair, communication. Dr. Francis mentioned hormones, but you've got cytokines, chemokines, you've got all these chemical signaling agents from your immune system that are going on all the time. In fact, the immune system is so diverse that as soon as you eat that inflammatory food or that ingest that chemical in food, or chew and release some of that methylated mercury into your system, your tongue tells your colon it's on the way. And so all internal organ systems are already set into an inflammatory mode, and how that manifests with you, it may be gingivitis, it may be arthritis, it may be some kind of itis. It's an inflammatory condition or autoimmunity. So,
right, yeah, we want an immune system that communicates in a tolerant way, not a hyper reactive way. And I think those words can ring true to personalities as well. All right, so moving on to our next question. So this person said that they're very interested in finding out some dental options. They want to remove a couple of root canals, and so they're wondering what are options if they're needing to remove some root canals. And they also said my issue is that one of them is the upper front tooth. And so that's an interesting question for the dentist.
So this, I like to put on what I call my tooth carpentry hat, because this is very much a clinical question. And I think dentists, there's a craftsmanship element to it. The clinical side is craftsmanship. We're doing little construction projects in the mouth. And so taking out a tooth is the excavation part of it. We do a lot of extra steps to clean the bone, clean out any infection that's left behind. We use lasers, we use ozone, do lots of scraping. Taking out teeth is one of my favorite things to do. I've got a great story about how I got to this point. We'll tell that on a different one. But so tooth has to come out. We're going to scrape and drill and clean and laser and ozone, do everything we can do to eliminate any residual infection in the bones. We want it to heal properly. And then so once a tooth is out, what are we going to do? We don't want people walking around with a gappy smile. One of my favorite jokes is, how do we know that the toothbrush was invented in Arkansas? Anywhere else, it'd be a teeth brush. So anyway, you don't want to walk around looking like you're from Arkansas. That's where I was actually born, so I gotta say that.
All right, you can say it.
So, or, it could be Alabama, it could be Tennessee, it could be not Texas. So lots of different ways to replace teeth. And again, it comes back to what's the status of the individual. If they're medically fragile and compromised, we want to do the least invasive thing possible because we want to eliminate burdens. You use the word burden a few times. I appreciate that term.
Right.
Because burdens, things that trigger the immune system, keep the whole thing out of whack, keep it in disharmony. So the least invasive thing we can do is make a metal-free partial denture. Those can look beautiful, look very nice. They don't function super well in the sense of biting, chewing, those kinds of things. But for an aesthetic concern, I have a lot of people walking around with a single tooth, front tooth partial denture that they're very happy with because they're on their own medical journey, their healing journey, and we're keeping the potential burdens low. So a removable denture or partial denture that preferably is metal-free. My personal tooth carpenter favorite is a dental implant. It's a one-tooth solution for a one-tooth problem. There are two different options for dental implants. Titanium, far more common, but potentially more burdensome. And then there's zirconia, which is a crystalline, non-electrically conductive, more biocompatible friendly option. So you drill a hole in the bone, you screw it in, you let it heal, and you put a cap on it. Takes about 4 to 6 months, depending on the time frame. But then you have a tooth that looks, feels, and functions like the one we took out. It's not like a partial, you're not taking it out. It works very well and they look beautiful. But it could be potentially a little more invasive and problematic depending on the person's kind of medical makeup, medical history. And then there's bridges. I call that a 3-tooth solution for a 1-tooth problem because you got to grind down the teeth on either side of the missing tooth. And you have 2 caps and 1 replacement tooth that are all glued together. And you stick that in, it's permanent. You cement it in. It works very well. Long-term solution, looks, feels, and functions like the teeth that were taken out. But it does put those adjacent teeth at risk a little bit for potential failure down the road. And then you lose another tooth and the whole bridge, and the 3-tooth problem solution for 1-tooth problem could have been fixed with the 1-tooth solution. So, but implants and bridges are permanent, stable, removable partials, less stable, but less invasive.
Okay, that's great. Thank you.
So Jason, we didn't talk before this of the importance of what, if we're gonna offer Prosper Nutrition support for dentistry, we don't have to afford the dental package, although we're working on developing a dental detox plan.
Right.
I know we've got the skeleton of that right now. We're gonna talk to Dr. Francis about that, but detoxing from the toxic elements, excuse me,
By
but
removing the heavy metals.
the immune panel or the immune bundle would really be the focus, because with it, we've got the ascorbate, we've got the quercetin as a bioflavonoid that helps with collagen for connective tissue repair. And so really strengthens gums. People that are on the immune bundle, we get the best comments coming back from the dentist saying, your gums look amazing. They really are healthy. And we see them actually, they're able to restore. We didn't talk about that much. You don't hear that a lot from a dentist. Everybody thinks as we age, we're going to degenerate. And you guys start talking about these chronic degenerative conditions that exist in America today. Our body is only designed to heal. So if there's something in the way, we're lacking communication, we're lacking repair, we're lacking immune support. We've got to give it that immune support so we can get those, right, all those aspects working. So we can see healing happen, and we see it at amazing ages. At 87 years old, they had a guy in the hospital bed, literally almost comatose. He'd been in the bed for 3 weeks. They removed his gallbladder, which is never a good idea. I don't know how many gallbladders we've been able to save through the years, but it's just an organ that's holding fat material, and that it goes all the way back to diet and how the liver processes the fats. But we detoxed this guy and got him out of the hospital in 3 days. And he was able to get up. He hadn't pooped in 3 weeks. We put him on live food, alkaline food, and he got 3 to 4 times a day. And bingo, that first night, he pooped 3 times. The first time in 3 weeks. So really want to encourage those live foods for live bodies, and the immune protocol obviously is gonna help with the dental support system.
Right, right. Yes, so we'll move on to the next question. I want to let everybody know. We are able to take questions live right now. And so if you are live, you can type in the chat any questions you have about dental health, about how nutrition impacts dental health. Any of these on the topic that we're addressing at hand. You can type in other questions too, but we probably won't answer them right now. But what we're going to move on to is the next question. It's actually two questions, it looks like, that go together. What are your thoughts on wisdom teeth? And then they go into asking, what if the dentist says there's no room and surgery is required? So I don't know if this is connected to the previous question about root canals, but these two seem like they kind of go together.
Yeah, so wisdom teeth, and this comes back to Weston Price, nutrition, physical degeneration. Skeletal structure is kind of getting smaller, more compact, and so room for wisdom teeth is decreasing. So they're coming in at angles, they're not erupting properly. But from what I see, wisdom teeth, depending if they're angled funny, they're a risk factor. Dentists generally look at them as a problem. If they're present, they're a problem. Let's proactively get them out of there. I don't see them as a problem. I see them as a risk factor that can be monitored. If that risk factor begins to escalate and it can't be managed or maintained, then we start talking about taking them out. Or if they are causing a problem, which it is possible they can cause pain. If they're actively causing a problem, then the only solution is to take them out. There's no other way to deal with them that I'm aware of. But yeah, dentistry as an industry, I think tends to recommend prophylactically or proactively remove them because they will cause a problem. I look at them as a risk factor that may cause a problem. If they get to that point, then we have a more serious conversation. And just so the second one, dentist says there's no room and therefore surgery is required. No, that's no room isn't a problem. That's the teeth might grow in at an odd angle. And when they grow in at an odd angle, there's a risk for plaque trapping in between the last molar and the wisdom tooth, or pain, or kind of chronic gingival infection back there. If those things start happening, then we address it. That's the problem that needs to be addressed. And the addressing the solution typically is taking the wisdom tooth out, but I don't see no room as an issue to cut. And so,
Yeah, that's good. That's really helpful. And I think this last question that we have here I think it goes along with these, but I wanted to separate it a little bit because it is a good question in itself. It's essentially saying thoughts about braces, like wanting to get your input about braces and avoiding braces. I don't know if they're saying that they want to avoid braces or if you recommend avoiding braces. I'm not sure what they're asking, but yeah, it would be great to get your input on, because that's something that is, being encouraged a lot in the very young years these days, it seems. But is there, I guess one of the things that I would like to know is there a certain timeline that you've learned is ideal for braces? That may be in addition to this question of your thoughts on braces. Is a timeline, and then one of the things that I saw with you and Mom, Amy, y'all did some altering of your teeth later in life, got some invisible braces, and that seemed to work fine when you were a little bit older. So some feedback on that, like when is a good stage of life to do something like that if it's needed.
Yeah, can I answer the question? You probably covered this anyway, but so my take on it was from the orthodontist that we wanted just healthier looking smiles and so forth. Just some of our teeth weren't aligned really well. And it's the alignment concerns that if you're compressing with chewing on, say, one of the meridians, and we didn't talk about meridians, but the entire body is connected to your teeth. The nervous system has connections in meridians to all of your teeth. The heart, the kidney, the digestive organs, everything's connected. And so we learned about that. And of course, by getting your bite more even, I guess that may have some impact on that.
Yeah, so It's never too late to straighten your teeth. We sell it. It's called Candid. So it's like Invisalign. Just kidding. So there's a lot to this question. And this is
We don't have to get into all of it then, right now.
I'll try to be brief and kind of because I'm treating a lot of people for the exact reasons that you just described, and straightforward, simple little Invisalign style braces takes about 12 to 16 months, and aesthetics, being not self-conscious or confident about your smile is a huge thing. It's psychological, it's emotional, it's spiritual. So there's never a wrong reason to beautify your smile. Don't people think, I'm so vain, I care about my smile? No, it's a crucial part of our self-esteem and our self-image. So being confident about your smile is super important. And braces is one way to gain confidence about a smile. But for the one thing that is happening in dentistry right now is to focus on airway. And airway tends to be an issue when people don't have enough space in their mouth for their tongue. The tongue is entrapped, and so it sits back in the airway, and they can't sleep. They can't breathe while they sleep, and so they can't sleep. And they're seeing very young kids are sleeping like this. They have severe sleep apnea because their faces aren't developing, and a lot of it has to do with their tongue. They have a tongue tie that doesn't. The tongue is nature's orthodontist, so it's developing the archlets. It's supposed to develop the upper jaw, so the jaw grows and the teeth come in a nice broad arch. A lot of kids that don't have enough room for their teeth is because their jaw develops only as far as their tongue can push. And if their tongue isn't pushing very far, their teeth come in all crooked. And then orthodontists say, well, let's wait till all their baby teeth fall out, which is 12, 13, 14 years old. Their canines or their premolars are sticking out here, out on the side. They say, well, let's pull those extra teeth and we'll make them look super pretty. And orthodontists are generally focusing on making teeth look straight, but have no, not awareness, but care, really, concern about airway and predilection for sleep apnea and those kinds of things. So getting things on a growth trajectory very young is a very exciting kind of new field in dentistry. And it starts by looking at the tongue. So you got to make sure the tongue is working properly, is strong enough, and is mobile. So it's a lot of tongue tie release procedures. And this isn't severe tongue tie, like you see infants that can't even move their tongue. It's mild to moderate tongue ties that, they have a relatively normal looking tongue, but when you look underneath it, that tongue's barely moving anywhere. And so their jaws just aren't developing. So it's a tongue training thing, it's a tongue tie release thing. And then depending on how severe the crowding is, there are different types of orthodontic appliances and removable or fixed appliances that really help expand and grow because young kids are growing rapidly. You can capture that growth and get that expansion. But if you don't address the tongue, likely they'll just collapse back because the face is going to pull back, the tongue is going to push out. And if there's not that harmony there, and if the tongue can't push out far enough to match the force the face is pulling back with, they're just going to collapse back. And so tongue is a root cause issue for a lot of crowding issues. And there's myofunctional therapy is a specialized speech therapy avenue that is growing, I think, pretty rapidly. It's not kids that can't talk, it's kids that have crowded teeth. The kids who have airway problems. ADHD is being, kids who can't sleep are being diagnosed with ADHD. When in reality, you fix the airway and all of their concentration and behavior issues. I'm not saying ADHD doesn't exist or anything like that. If the kid has an airway problem, they can't sleep, they're gonna have behavior problems. So that's one thing for braces. So could you ultimately avoid braces? Yes, if you get the tongue fixed, if you get the tongue tied down, you do all of those things early and maximize the growth phases, then you maximize the growth potential for that individual. Braces might do some fine tuning if you want to do that, but the need to use braces because the teeth are all crowded becomes less necessary. And but for older people who like this guy over here, you said 87. I thought you were talking about yourself a second ago. No, people come back all the time going, my teeth are so much easier to clean now, and that's a big part of it. And maintaining for the long term, and people will say, I finally want to take care of myself. That's and just simply realigning the teeth a little bit so they look a little better, they're easier to clean. And they literally feel like they have kind of a new lease on them. And so there's not a wrong way to do it. And then you talked a little bit about kind of how the teeth touch, and I'm just going to touch on the trigeminal nerve. You did mention that. It's a massive cranial nerve that has 3 big branches that is gathering tons and tons and tons and tons of data through all of our teeth, through our tongue, through our palate, through our airway, through our jaw joint. That is sending tons of data. And our teeth are proprioceptive nerve endings, is what they are. They know where they're supposed to be in space. They know how they're supposed to touch. They know how they're supposed to be related to the jaw joint. This is the only joint in our body that has bilateral that's connected across the body. Every other joint is independent. This one is connected, and so the body, the brain, is taking tons and tons and tons of data back from this whole part of our body. And if the bite's off, if the teeth are getting funny, if the jaw joint is compressed, there's a lot of things that can go on that send this chronic stress pathway back to the brain, saying something's off, something's off. If you're used to folding your arms this way, and then you fold them this way, it feels really funny. Our brain knows that. It's taking all that data. And so orthodontics is one way to address potential what we call malocclusions or bite issues or jaw joint issues to create harmony. And when you have harmony, there's less stress. When you have less stress, there's less inflammation and immune system dysregulation. And so that's one of the things that can be looked at.
It was great. That was great.
Yeah, well, we have more and more things that to talk about, and you mentioned that I really hope that this is something we can do maybe on a monthly or something like this, because this is valuable information that we can dive deeply into that a lot of people can benefit from. I think a lot of people are missing this. I mean, things are changing obviously in our progressive culture, and more chemicals in our environment, more processes going on, more things we need to know about how it impacts our body. But then there's also the lost old wisdom that we need to bring back too. So I think this is hopefully a start to more conversations that we'll be able to have on the show here. But this is all we're going to touch on today. Thank you all for sending in the questions. That was really great. And we are going to see you guys next week at 10 a.m. Central Standard Time on Thursday. This was a little bit of a deviation. We might make an adjustment permanently, possibly, if this works better with Dr. Francis. But for now, we're going to be seeing you next week, 10 a.m. Central Standard Time on Thursday. Thank you all for watching, and we look forward to seeing you next time. Prosper and be in health. Take care. Bye-bye.
I have a question.
Yeah.
Because you mentioned the airway thing. And